Hello, dear students. Hope audio video everything is okay. Hope your exam, all the things are in a good way. So, anatomy questions, yes, most of the questions were easy, but few questions were very tricky, and one, two questions are totally new in pattern. So, can we start? Please inform me that audio video everything is okay. Yes. So, we are going to look the changing pattern. Yes, almost the pattern is same, but little bit few questions are deviated. So this is the session on the basis of the recall question, and options may be different. Please suggest any kind of a correction. So analysis, till now I got total pure anatomy question 11. Yes, definitely if you will integrate, then you will get the more and more questions, because anatomy is the basic subject and all the subjects are arising from the anatomy. Yes. Yes, Parmeshwar Sai, study, everything is okay. No? Yes, dhak dhak, male life healthy. So this time, general anatomy, no question. Generally, the one question from the joint is definitely asked from the in our INICET, but this time no question from the general anatomy. Head, neck, and the face, 5, and neuroanatomy, 2. So total 7 question. So can you see 7 by 11 question? So for the INICET, it is clear cut during our session, during our any kind of a session, in the videos as well as in our regular session, in the marathon session, in our mission classes, I always told you, for the INICT we have to mainly focus for the, yes, head, neck, and the neuroanatomy portion. You can see among the 7, among the 11, total 7 question had been asked. Yes, surprisingly this time I am not getting any question from the upper limb. If you got any question, yes, any question from the upper limb, please inform me. No question from the thorax, no question from the abdomen. Okay, lower limb, one question. Gluteal region, as I told you in the 10 questions also, that gluteal region definitely it will be asked. This time gluteus maximus, again it had been asked. INICET is famous to repeat the topics. This time again they proved. Pelvis, yes, one question only. Embryology, again they asked the pharyngeal arch artery. And histology, one question from the gland, but this time they given the lots of the question. Okay, so okay. Okay, Joshna, you are saying nerve injury, okay sign. One question from the upper limb, that is the okay sign. Thank you. Thank you, Joshna. So now look here. Okay, shoulder dislocation also. So I'm adding the shoulder dislocation. You can get this topic in the orthopedics also, no? Okay. Fine. So we are going to discuss about the head and neck question. So look here, which bone is attached with the marked area? So they given the ring shaped structure. Yes, we had seen many times during our classes with the three-dimensional orientation, cadaveric images also. So this is our beautiful three-dimensional orientation during the class. I inform you, sir. This is the our skull. Yes, you can see the first bone. Lal full, Neela full, anatomy beautiful. Sir, this is the first bone atlas, and it is clear cut, getting articulation with the our, yes, occipital bone. This is the atlanto-occipital joint, which is responsible for the yes movement, while the atlanto-axial joint is responsible for the rotatory movement. That is a pivot joint, which is the no movement. So hope you all did correct this question. It is easy question. Answer was the occipital bone. Any change in the option temporal bone, occipital bone, axis, or sphenoid bone? Please inform me, dear students. Yes. Now come to the next question. Again, INICT, famous for the muscles of mastication. Again, they proved. Okay, INICT is famous to repeat the topics. A patient presented with the difficulty in opening the jaw but not in closing. Which statement is false about the involved muscle? So definitely, which muscle is the opener of the jaw? So only depressor is the lateral pterygoid. I told you the formula for the action of the lateral pterygoid. Delhi Public School. Yes, lateral pterygoid is responsible for the depression. Yes, it is the protractor, and it is responsible for the side to side movement. Okay, so now try to catch. Yes, lateral pterygoid is very favorite. Yes, Khushnuma, you're right. So during our classes, I had shown you all the muscles of mastication, and this is our lateral pterygoid muscle. Can you see? Sir, this is our lateral pterygoid plate, and this is lateral pterygoid muscle, which is getting insertion in the pterygoid fovea, which is very close to the temporomandibular joint. Very clear question we discussed during our mission classes in our regular video all. So it is attached near the temporomandibular joint. Yes, it is right. They are asking the false. It is supplied to the mandibular nerve. Definitely all muscles of mastication, they are derivative of the first arch, and the first arch nerve is the mandibular nerve. And apply the Hilton law. जो नदी जहां रहती है, जहां बहती है, उसे सप्लाई करती है. So definitely it is supplied by the mandibular nerve, right? Depresses the mandible while mouth opening? Definitely it is a depressor, so it is also right. Attached to the medial pterygoid plate? No. I had shown you right now the three dimensional orientation. Sir, it is not attached to the, yes, medial pterygoid plate. You can see this is the lateral pterygoid plate, that is a medial pterygoid plate. It is not attached to the medial pterygoid plate, but it is attached to the lateral pterygoid plate. हाथ कंगन को आरसी क्या, पढ़े लिखे को फारसी क्या? Yes, we had seen all the cadaveric images in three-dimensional orientation. Hope you all did write this question, na? Yes, okay, question number DPS is sahi hua na? Very nice. Now again, during the classes, I told you also the 10 topics I given. That definitely one question from the cranial foramen. Cranial nose, one question is going to ask. So this time, nose supplying to the muscles of mastication passes through which foramen? So they marked, yes, muscles of mastication. Right now, I told you again, it is the topic of the pharyngeal apparatus. Yes, muscles of mastication. Here, this is our first arch. And first arch, which nerve is flowing here? Again, Hilton law. जो nerve जहां रहती है, जहां बहती है, उसे एक supply करती है. So answer is the mandibular nerve. And we know very well the mandibular nerve, it passes through the foramen oval. The formula, the very famous formula from the first MBBS: M for mandibular nerve, A for accessory meningeal artery, L for lesser petrosal nerve, and E for emissary vein. Now we have to identify where it is passing. So I told you the formula to identify the difficult foramen. बीचों बीच में कौन रहता है? किंग. ओके, राजा. राजा के दोनों तरफ कौन रहती है? रानियां. यस, क्वींस. क्वींस आर शाई इन नेचर. यस, फोरामेन लेशरम. राजा रानी को रोज देता है, ROSE. यस, और यहां पर हमने एक नॉनवेज जोक भी मारा था, राजा रानी को रोज देता है, रोज देता है नहीं कहा था. ओके, सो कैन यू रिकॉल? हमारे हॉलीवुड बॉलीवुड टॉलीवुड इंटीग्रेशन और जोक से क्वेश्चन आए. सो यू कैन से, सर दिस द फोरामेन रोटंडम. सर दिस द फोरामेन oval. Yes, and this is the foramen spinosum from where the emissary vein may pass, may not pass. So this was the answer, foramen oval. Yes, yes, Mohsin, hope you did correct. King queen को rose देते हैं. Yes, perfect, Mohsin, you did right. So answer in this question is the foramen oval. Any change in this question? Yes, foramen was marked. Aman, you are right, better. Hope you all are getting the point. Yes, yes, yes. हाँ, रोज देता है नहीं, रोज देता है, ये हमारा फनी निमोनिक था. Now come to the next. All of the following structures are related with dysphagia except. Okay, so this is the question integrated with the ENT as well as you can say the medicine also. Okay, so related with the dysphagia, yes, for the proper our mastication, for the proper our swallowing, yes, the palatopharyngeus muscle of the pharynx is responsible. Yes, stylopharyngeus, it is also the muscle of the pharynx. Yes, pharyngeal constrictor, we studied this all the muscles in our pharyngeal apparatus part. Muscles of the pharynx also, it is a topic of the ENT. But the tensor veli palatini, it is related with the palate. Palate is not participating in the our swallowing activity, so answer is D. Yes, any correction in this question, better? Okay, image was given. Okay, image, I will add image. Okay, image, no? Okay, a cadaveric image or animated image. Dysphagia and dysarthria. Dysarthria, okay beta, okay, thank you so much. Okay, image with ABCD. Okay, I will make more, I will add the more things, no? Okay, thank you. So this was the cadaveric image, this was the cadaveric image. Okay, thank you Khushi, thank you beta. Okay, fine. Only image. Now, can you help me in this question? Cranial nerves pass through which of the following bone? This time they disarticulated the bone. So they given the temporal bone. Yes, they given the maxilla bone, and they given the, yes, sphenoid bone, and one more bone. Can you help me? कोई बात नहीं खुशनुमा. ग्लॉसस मसल था इमेज में. ओके, आई विल सी. वैभोजन CNS. ओके, cranial nose CNS. So just to see, I'm not getting exactly the question, and one image is also missing. Okay, but I'm trying for it. Okay, look here, which cranial nerve is passing? So now try to understand. Temporal bone is passing the facial nerve. Maxillary nerve, it is passing the our foramen rotundum. It is coming as the infraorbital nerve, and this is our sphenoid bone. Yes, can you see this is the superior orbital fissure? Three-dimensional orientation we had seen, na? So during the class, we had seen the proper three-dimensional orientation. Yes, and at that time I had shown you this image again. Two question from here. So this is the view. This is the view. Okay, so here is our superior orbital fissure. So the same image was given, and we know from the superior orbital fissure, sir, third nerve Sir, fourth nerve, sir, sixth nerve, also the fifth nerve. Many cranial nerves are passing. So I don't know what was the exact question, and one image is also missing, but this sphenoid bone may be the answer. Okay, yes, Kshitiz, nerve from CNS pass through which of this foramen? Fine. Okay, but it may be the answer. I will find. Can you help me more? Fourth image was cranial fossa with cribriform plate. Okay, Abhinav, thank you, beta. Cribriform plate. Okay, so maximum nerves are related with this sphenoid, third, fourth, sixth. So you can go with that one. Otherwise, cribriform plate, again the first cranial nerve is related here, na? First cranial nerve is related here. Temporal bone, it is related with the seventh nerve. Yes, maxillary nerve, it is passing the foramen rotundum, it is coming out through the infraorbital foramen. Okay, so all are passing any branch, but if any one answer, so maximum nerves with the sphenoid, so sphenoid may be the answer. Zygomatic bone was given. Okay, I'm writing the zygomatic bone also. Okay, so I have to see for the zygomatic bone. Okay, वन ऑफ द नर्व पास होती है जो सेंट्रल नर्व सिस्टम को बिलोंग करे, विच स्कल बोन पार्ट्स से एटलीस्ट वन ऑफ द नर्व पास होती है जो क्रेनियल नर्व सिस्टम को बिलोंग करे. ओके, अगर ऐसा हो तो बेटा क्रिबिफॉर्म प्लेट भी हो सकती है. I will see, no? Okay, I'm moving for the neuroanatomy. So in the neuroanatomy, yes, they given the, yes, the brain stem, dorsal view. Do you remember during our regular class we discussed about this all? Sir, floor of the fourth ventricle. Sir, there is the stria terminalis. Yes, this is the floor of the fourth ventricle. Here is the facial colliculus. Yes, superior colliculus, inferior colliculus. And this time they focus for the superior cerebral peduncle, middle cerebral peduncle, and inferior cerebral peduncle. During the magic of the cerebellum, 1, 2, 3, 4, 5 of the cerebellum, I taught you the cerebral peduncle. So this is the area of the superior cerebral peduncle. Here is the area of the middle cerebral peduncle, and here is the area of the inferior cerebral peduncle. So they marked. Okay, I'm not getting the exact marking what they did, but students were saying about the inferior colliculus was correctly marked. Okay, or I'm not getting exactly the marking. There was the A, B, C, D, something like that. Okay, so but this kind of the question was there. I will make the more perfection in this question in the wording and the correct image, and then I will inform you better. Okay, yes, yes, Khushi. Now there was the one question: which lobe is involved in the visual tracking or scanning? Match the following. Okay, this was the match the following type of the question, na? Okay, which lobe is involved in the visual tracking or scanning? So can you tell me such kind of question was there? Okay, scanning. Okay, see here, visual tracking, if they are asking about the visual tracking, then you can go with the occipital lobe, na? But if they are asking about the scanning, so you know when we read, our eyes are following the same direction, left to right. और हमने एक यहाँ पर जोक मारा था क्या, कि अगर मुझे जल्दी पढ़ना है तो लेफ्ट आई तो लेफ्ट से पढ़, राइट आई तो राइट से पढ़, ऐसा नहीं होता. ओके, सो इफ दे आर आस्किंग अबाउट द स्कैनिंग मीन्स कॉन्जुगेटेड saccadic movement which is controlled by the frontal eye field area. Yes, this is the area number 8. So in that condition you have to go for the area number 8. So we have to look for the options. Okay, if they are asking for the visual tracking, then go for the, yes, occipital lobe. But for the scanning, then if the frontal eye field is given, yes, then you have to go for the area number 8, na? Can you inform me? Occipital. So see here, if visual tracking is given visual pathway, then you can go with the occipital, na? And I have to look for the options, na? What was the option? What was the exact? I'm not sure about the correct answer right now, na? स्कैनिंग पूछा था. ओके, स्कैनिंग पूछा था, स्कैनिंग पूछा था, तो फिर कॉन्जुगेटेड सैकेटिक मूवमेंट की तरफ जाना पड़ेगा. एंड इफ द फ्रंटल आई फील्ड फ्रंटल लोब इज गिवन, देन यू हैव टू गो फॉर द फ्रंटल लोब, ना? ओके, वी विल सी नाउ अपर लिम्ब. Right now the students are saying okay sign and shoulder dislocation. Can you inform me beta what was the question? Okay, स्कैन पक्का था तो बेटा फ्रंटल लोब की तरफ जाओ, वो ज्यादा अच्छा है. फ्रंटल लोब वाज गिवन इन द ऑप्शन, फ्रंटल आई फील्ड एरिया. Okay, yes, congratulations Virat, nice attempt. Scanning. Okay, okay, fine. Now okay sign. सेप्टम पेलुसिडम डायग्राम, ओके, दिस इज द न्यू मुकेश, आप क्या बोल रहे हो बेटा, सेप्टम पेलुसिडम का डायग्राम क्या था? ये नया क्वेश्चन, ये किसी ने मुझे नहीं बताया, क्या था ये क्वेश्चन? Okay, yes, shoulder dislocation X-ray. So this question will go to the your orthopedics as well as the radiology, no? Okay, sign which nerve? So anterior introitius nerve. Anterior introitius nerve was given. Okay, sign anterior introitius nerve. Discussion close. Okay. Septum pellucidum divides the, yes. Septum pellucidum divides the two lateral ventricle. Septum pellucidum divides the two lateral ventricles. Yes, it is making the wall of the lateral ventricle. It was image based question, one liner question. Septum pellucidum is related with the lateral ventricle. It is in between the two lateral ventricle. Median nerve, okay. If this is the best answer, if it is not given, then median nerve is the answer. Yes, CSF mnemonic, definitely. Vivogen, CSF, THP, MPN. Okay. So this was not given. So median nerve was given. So you will go with the median nerve. Okay. Okay. Thank you. Thank you, Manish. Now, lower limb. One question. Always during the class, always I was saying, INICT people, they love the gluteal region. They love the gluteal region. Always, you will see the INICT 2021, 22, 23, 24, 25. Always you will see either the gluteus medius minimus or the maximus. Two times they ask the gluteus maximus. So muscle responsible for the VP extension, definitely the gluteus maximus, and it is also causing the knee extension via the, you can say, iliotibial tract. Yes, there is a one iliotibial tract. Catch this one, sir. There is the iliotibial tract. So during our three-dimensional orientation, I was showing this iliotibial tract. Can you see, sir? This gluteus maximus muscle. This is the gluteus maximus muscle. This is the chief extensor. Where muscle goes, there movement flows. The third Escavian rule. Yes, it is backside, so it is causing extension. Okay, fine. Our third magic, and then it is getting insertion into the our gluteal tuberosity, but it's three-fourth fibers are also getting insertion into the, yes, this iliotibial tract. This is extending from the ilium, and then it is going to the tibia. It is going to the tibia. Are you getting? It is going to the tibia. You can see iliotibial tract. So it is crossing the knee joint from the front. So it is also participating in the extension. It is not the chief extensor, but it is helping in extension. It is helping in extension. Getting the point? So among the given option, this is arising from the iliac crest. Yes, sir. This gluteus maximus is taking origin from the iliac crest. Tell me, beta, if any correction is needed. So answer is the iliac crest. As originally of the, yes, they ask about the origin of the, and this is the repeated question. It was asked in the May 2025. That's why always we say that INICT is famous to repeat the topics. One more question there is, which not attached to the iliac spine. Yes, we are coming, Pamisha, we are coming for that question also. Now the thorax, no question. Yes, abdomen, no question. Please inform me if any question was there. Now pelvis, मार्क किया था ABCD, ओके, तो इसमें मार्क ABCD मीन्स इट वाज इमेज बेस्ड क्वेश्चन ना, ओके, ओके फाइन, यस. Now, look here, pelvis. Which of the following? This is the question from our UG time. Na? Do you remember? With the ischial spine, the PIN, pin is related. And when I teach to the student, then I tell them, Pinto, Albert Pinto को गुस्सा क्यों आता है? Yes, P for pudendal nerve, I for internal pudendal vessels, N for nerve 2, obturator internus, and T for tendon of obturator internus. Yes, in your textbook, the mnemonic is given, that is the pin, but we added here the TO also, pinto. These are the structure. So pudendal nerve, internal pudendal vessels. They given the only pudendal vessels. You have to understand that they are asking about the internal pudendal vessels. Okay. Now ischiococccygeus, yes, it is the pelvic diaphragm topic. Do you remember I taught you the pubococcygeus plus iliococcygeus plus ischiococccygeus is equal to pelvic diaphragm. So this ischiococccygeus is also related, but tendon of the obturator externus, आखिरी वर्ड में ये खेल गए, आखिरी वर्ड में ये खेल गए. They are not giving the obturator internus, they given the obturator, they are not giving the obturator internus, no, they giving the obturator externus. So in this question answer is the 4. इलियक क्रेस्ट इमेज में लेबल नहीं था। ओके, तो क्या था बेटा, ऐसा इससे रिलेटेड कुछ था क्या? यस, नॉरस बेटा, डॉक्टर एजे। यस, प्लीज इन्फॉर्म फॉर दैट। हिस्टोलॉजी, हिस्टोलॉजी में एक क्वेश्चन था लेकिन उसमें चार इमेज थे, एंड आई एम नॉट सक्सेसफुली गेटिंग व्हाट दे गिवन। हिस्टोलॉजी showing the four glands, asking which one does not have endocrine function. Always I told you in the our every session, epithelium and gland you have to study. They ask this time the gland, uterus, spleen, pancreas, parotid, something like that. I am not getting exactly the image, till now. Students are very confused here, so I am not exactly getting. But histology one question. And last, embryology. Embryology was giving the again the pharyngeal apparatus and pharyngeal arch artery. So second arch artery, stapedial artery, hyoid artery, third arch artery, common carotid, internal carotid artery, fourth arch artery, supplementary artery in the arch of aorta on the, yes, this is on the right side and this is on the left side, and sixth arch artery, that is our pulmonary artery and ductus arteriosus. So we know exact framing is needed. So thank you very much. Kindly help in the correction of the wordings, recall of the other option. Thank you.